All right, so get this. Today we are going deep inside, like really deep inside, the human gastrointestinal system.
Well, this is going to be good.
Yeah, it is. The sources you gave me, they kind of look like someone's study notes,
Yeah.
like maybe for nursing school or something.
Uh,
But don't worry.
it's a crash course.
Yeah, we are not going to make you take a test or anything. We're just going to break down all this cool info about how our bodies, turn food into fuel and make everything work.
It is truly amazing. You know what's so remarkable?
What?
This system, which seems so basic, like we all eat, we all digest,
Right, right.
but it is an amazing feat of like biological engineering.
Yeah.
All this stuff working together, the digestion, the absorption, the elimination.
Yeah, eat, absorb, eliminate. Got it. But there's got to be more to it than that, right?
Oh, way more. Way more.
So where do we even start on this journey through the digestive tract?
Okay, so just like any good road trip, got to start at the beginning.
Okay.
And the beginning is the mouth.
Obviously, yeah.
So from there, we're going down the esophagus. It's that muscular tube that propels the food downward. It's like, squeezing a tube of toothpaste.
I see.
But instead of minty freshness, we're moving food.
Right. Peristalsis.
There you go.
That's what it's called, right?
Yes.
One of those words you learn in science class.
Uh-huh.
That always stuck with me. Okay,
Mhm.
so the food gets squeezed down the esophagus into the stomach.
Yes.
That's where the real action starts.
That's where things get turned up a notch.
Yeah.
Think of your stomach as this high-powered blender.
Okay.
It's mixing the food with like these strong acids and enzymes that are breaking down those proteins. It's a pretty intense environment.
Which explains why heartburn is so awful, right?
Yeah.
Oh, it's that acid splashing back up where it doesn't belong.
Yeah, this acid reflux, that's when it's kind of like a little valve between the esophagus and the stomach
Okay.
that malfunctions, and boom, you get that burning.
Yeah, not fun. Okay, so the next stop on our tour, the liver.
Oh, the liver.
Judging by these notes, this organ has a lot of jobs.
Multitasking.
Yeah.
At its finest. People say, eat your veggies.
Yeah.
Your liver is a major reason why. This thing is like a detox powerhouse.
What?
Filtering all those toxins out of your blood. But it also produces bile to help break down fats.
Right.
It stores glucose for energy.
Okay.
And it even stashes away vitamins. This thing does it all.
Wow, that's impressive. Okay, what about the pancreas? I always thought that one was kind of a mystery.
Yeah, well, the pancreas is like a double agent, right?
Okay.
It plays a role in both digestion and hormone regulation. So on the digestion front, it's producing these enzymes that break down carbs, proteins, and fats in the small intestine.
Okay.
But then it also makes hormones like insulin and glucagon, which manage your blood sugar levels.
Oh, right. Insulin and glucagon, those are important for people with diabetes, right?
Huge, absolutely. It's all about balance, right?
Right.
Insulin helps your cells absorb the glucose from the bloodstream. And then glucagon kicks in to raise the blood sugar when it dips too low. It's like this little dance.
A delicate balance.
Yes.
Okay, so after the stomach turns everything up, it moves into the small intestine, right?
Yes.
But wait, if it's the longest part of the digestive tract, why is it called the small intestine?
It's all about perspective.
Okay.
Small refers to its diameter, not its length.
Oh.
But don't let that fool you. The small intestine is where all the nutrient absorption happens.
So it's small but mighty.
Exactly. So imagine millions of tiny little fingers lining the walls, grabbing onto all those nutrients from your digested food.
Okay.
And those are called villi. They maximize the surface area for absorption.
Wow, that's a much better image than just a long tube.
Yeah, it's pretty amazing. And to keep things organized, the small intestine has 3 sections: the duodenum, jejunum, and ileum. Each of them has its own special role in the absorption process.
Very efficient.
Very efficient.
Okay, so then whatever's left over after all that nutrient extraction, it goes to the large intestine.
Yes.
And these notes say that's where the water and electrolytes get absorbed.
Right. So the large intestine, also known as the colon, is shorter than the small intestine,
Okay.
but much wider. And it's got all these different sections: the cecum, ascending, transverse, descending, sigmoid, colon. And its main job is to make sure you're not constantly running to the bathroom.
Right.
Absorbing that water is key.
Yeah. Very important. But what about the appendix?
Oh, the appendix.
People get theirs removed all the time. What even is its purpose?
Yeah, that is a good question. It's that little pouch attached to the cecum, but its exact role is still a little bit of a mystery.
Really?
Yeah. What we do know is it can become inflamed and infected, which leads to appendicitis.
Right.
And then you need surgery. So it's definitely something you don't want to mess with.
So better safe than sorry with that one.
Exactly.
Okay, after the large intestine does its thing, we end up at the final destination.
The end of the line.
The rectum and anus.
You got it.
The rectum is like the holding area for the waste, right?
Uh-huh.
And the anus is the exit point.
The grand finale.
Yes, exactly. So that was quite a journey.
The digestive system.
Yeah, it's amazing. But here's something I've always wondered. Does this whole elaborate system, does it change as we get older? Because these notes mention something about aging and the GI tract.
Oh, yeah, definitely. Just like everything else in the body, the digestive system changes with age. Like, it's kind of like the next chapter in our digestive adventure.
Okay, tell me more. What kind of changes?
Well, for starters, peristalsis. Remember those wave-like muscle contractions?
Yeah.
They tend to slow down,
Okay.
and that can lead to constipation, which a lot of older adults have to deal with.
That's why my grandma's always talking about prune juice.
Makes sense. And it's not just about things slowing down. The production of saliva and digestive enzymes also decreases with age.
Huh.
And that affects our ability to break down food and even how well we taste things.
Oh, interesting. So it's like the system's efficiency declines.
Yeah, you could think of it that way, like a car that needs more TLC
Right.
as it racks up the miles.
Yeah, good analogy.
The lining of the digestive tract also thins with age,
Okay.
which can make us more vulnerable to infections and ulcers.
Oh, no.
And then you remember that lower esophageal sphincter?
The one that's supposed to keep the acid down?
Yeah, it tends to weaken too, increasing the risk of heartburn.
Wow, this is making me want to eat a big salad and do some yoga or something.
Yeah, good idea.
Keep everything running smoothly.
It's good to be mindful of your digestive health at any age.
Right, that's true. Okay, so we've talked about how the digestive system works and how it changes as we get older, but what happens when things go wrong?
Right.
These notes mention all sorts of different pathologies, and some of these terms sound pretty intimidating.
Yeah,
So let's demystify them a little bit.
absolutely.
I don't think our listeners need a medical dictionary to follow along.
We'll break it down.
Yeah, some of these words are making my stomach churn more than a double cheeseburger.
Yeah, let's start with anorexia. So you're probably thinking about the eating disorder.
Right.
But in this context, in these notes, it just means loss of appetite,
Okay.
which could be a symptom of a bunch of different things.
Right.
And then there's eruptation.
Eruptation.
That's just a fancy word for burping.
So whoever's burps after a big meal, that's just my eruptation in actions.
Exactly.
Okay.
Now, here's one you asked about earlier.
Tituria. Stituria, yeah.
That sounds scary, but it really just means there's too much fat in the stool,
Oh.
which could mean there are problems with fat absorption.
Okay.
And lastly, we have ascites,
Ascites.
which is a buildup of fluid in the abdomen,
Okay.
and that's often caused by liver disease.
So those are all signs that something might be a little off.
Yeah,
But how do doctors actually figure out what's going on? How do they diagnose these conditions?
that's where all those diagnostic tests come in. And these notes mention several ways that doctors can get a look inside the digestive system
Oh, interesting.
to see what's happening.
Okay, let's talk about those tests.
Absolutely.
I'm curious to know how they actually work.
Let's do it. Okay, well, one of the tests they talk about here is an obstruction series. It's basically a set of x-rays you take to look for blockages in your intestines.
So if someone's like having really bad stomach pain and they think something might be stuck.
Yeah, that's when they do this. It's like they get a roadmap of your gut,
Oh, wow.
and it helps them see things like tumors or cysts or even if there's a twist in the intestine.
Okay, yeah, that makes sense. What about this upper GI series? I read in these notes that they use barium for that.
Uh-huh.
So what is that all about?
Well, so they make you drink this barium solution,
Okay.
and it basically coats the lining of your esophagus, stomach, and the first part of your small intestine.
Okay.
And it shows up really clearly on x-rays.
Oh, like a highlighter.
Exactly. So then they can see if there are any ulcers or tumors or anything else unusual in there.
Oh, that's interesting. I've heard that barium can make you constipated, though.
Yeah, it can. That's definitely something to keep in mind. And then another test they talk about here is gastric secretion analysis.
Gastric secretion analysis. Okay, break that down for me.
Basically, they're measuring how much acid your stomach is producing.
Okay.
It helps them diagnose things like peptic ulcers or a condition called Zollinger-Ellison syndrome, which causes your stomach to make way too much acid.
Oh, wow. So it's like a stomach acid meter.
Pretty much, yeah. And of course, you've got the good old stool test.
Yeah, the stool test. We all know what that's about.
Not the most glamorous, but hey, it gives them a lot of information about what's going on in your gut. Infections, inflammation.
Right. Okay, got it. Moving on, we've got the lower GI series. They also call it a sigmoidoscopy.
Yeah, sigmoidoscopy. So that's where they use this little flexible tube with a camera on the end to look at the lower part of your large intestine.
Okay.
They're looking for polyps, hemorrhoids, things like that.
Okay. And then there's the colonoscopy, which is kind of like, that's the gold standard for checking out your whole colon, right?
Yeah, that's right. It's a little bit more involved than the sigmoidoscopy,
Okay.
but they get to see your whole colon. So that's how they find polyps, tubers, anything that looks abnormal.
Right. Really important for catching colon cancer early.
Absolutely. And then they mention the liver function test in here. I'm guessing that's a blood test.
It is, yeah. They use that to check how well your liver is doing.
Right. They measure levels of different enzymes and proteins in your blood.
Okay.
And that gives them an idea of your liver health. If those levels are off, it could mean there's inflammation or damage or even liver failure.
Wow. Okay, so lots of different ways to get a glimpse inside the digestive system. Speaking of getting a glimpse inside, these notes have a whole section on tube feedings.
Yeah, tube feedings.
That sounds intense.
It can be, yeah. So they use those for patients who can't eat enough by mouth.
Okay.
Like if they have trouble swallowing or if they've had surgery or maybe they're just really sick.
Okay.
But it's not just about getting calories in them.
Right.
It's about giving them a balanced diet.
Yeah, that makes sense. So in these notes, they talk about different kinds of tube feeding formulas.
Yeah,
Polymeric, elemental, and modular.
right. Sounds like a chemistry lesson.
Yeah. So what's the difference between all those?
Okay, so the polymeric ones, those are the most common.
Okay.
They're kind of like, blended food,
Oh.
whole proteins, carbs, and fats that need to be digested, just like regular food.
So like a pre-digested meal in a bottle.
Yeah, kind of. Those are usually easy to digest,
Okay.
but the person still needs a functioning digestive system to break them down.
Okay, so what about the elemental formulas? Those sound a little more high-tech.
Yeah, the elemental formulas, those are already broken down
Okay.
into the simplest components, amino acids, simple sugars,
Okay.
and fatty acids.
So the body can absorb them more easily.
Exactly, especially if someone has problems with their digestion.
Oh, that's good. Okay, and then there's the modular formulas. That sound interesting.
Yeah, those are all about customization.
Really? So how does that work?
Think of them like nutritional building blocks.
Okay.
They're meant to add specific nutrients, maybe more protein, more fiber, or certain vitamins and minerals.
Oh, I see. So it's not like a full meal replacement.
No, not really. It's more like a way to fine-tune their diet.
So if they need a little extra something, you can just add it in.
Exactly. You tailor it to what they need.
Wow, that's so cool. There's so much that goes into this, like the science behind it.
It's pretty fascinating. Speaking of things that people don't always understand,
Yeah.
enemas.
Enemas, yeah. Not exactly dinner table conversation.
Right, but you know what? Enemas are a really useful medical tool,
Okay.
and they're used for a lot more than just relieving constipation.
Yeah, we mentioned all those different types before, like the cleansing enema and the hypotonic and the hypertonic and the oil retention and the hair's flush.
Right.
Can we break those down a little bit? What's the difference between all of those?
Sure. So the cleansing enema, that's the most basic one.
Okay.
It's like giving your bowels a big flush.
Oh,
They
okay.
use it to clear things out before a procedure or to help with constipation. And it basically works by putting a lot of fluid into the rectum,
Okay.
which softens the stool and makes you go.
Okay, that makes sense. What about the hypotonic ones?
Yeah. So hypotonic enemas, they use a solution that has fewer particles in it than your body fluids.
Okay.
So that makes water move into your intestines,
Oh.
and it softens the stool. And they often use those for patients who are dehydrated or have electrolyte imbalances.
Interesting. So it's all about the balance of fluids.
Yeah. And then there are the hypertonic ones, which are the opposite.
Okay.
They have a higher concentration of particles,
Uh-huh.
which pulls water into the intestines
Oh.
from the surrounding tissues.
Okay.
It's a more aggressive way to, get things moving.
So if you need a little extra help, that's the one to go for.
Yeah, but you have to be careful with those, especially for people with kidney problems.
Mm-hmm.
What about the oil retention in enemas?
Yeah, those sound kind of gentler.
Yeah, they are gentler. They use mineral oil to lubricate the stool
Oh, okay.
and make it easier to, pass.
Makes sense. Okay, and then there was that Harris flush.
Right, the Harris flush, that's a specific type of enema they use after surgery
Okay.
to relieve gas pains.
Oh, okay.
So they gently flush fluid in and out of the rectum,
Okay.
and that helps stimulate peristalsis and move the gas along.
So like a gentle intestinal massage.
You got it. And then there are rectal tubes.
Yeah, those sound less intimidating than enemas.
Yeah, they're smaller
Okay.
and more targeted. So they put a little flexible tube into the rectum.
Okay.
And they use it for different things like relieving gas or stimulating a bowel movement or even managing fecal incontinence.
So it's more for specific situations.
Exactly. Like if someone's uncomfortable from gas, a rectal tube can let the gas escape.
Okay, that makes sense. What about like for people who can't control their bowel movements?
Yeah.
Can a rectal tube help with that?
It can. They can connect it to a bag so that, there are no accidents.
Okay, that's good. It's amazing how many different ways there are to deal with these problems.
It really is. And it just shows how complex the digestive system is.
It does. Okay, so we've explored how the system works, all the different tests they use, and even some ways to manage things when they go wrong. What's next on our digestive adventure?
Well, now that we've got the basics down, I think it's time to dive into some specific conditions that can affect this whole system.
Okay, lead the way. I'm ready for more digestive discoveries. Okay, so we've made it through the digestive system's journey, and we've talked about all the tools doctors use to keep things running smoothly. But now I think it's time to talk about some specific conditions.
Yes.
Some of those things that can really throw a wrench in the works. I'm ready to hear about these digestive dilemmas.
Okay, well, let's start with GERD, gastroesophageal reflux disease.
GERD. I've definitely heard of that one. Isn't that just a fancy name for heartburn?
Well, heartburn is a common symptom, but it's more than that. GERD is a chronic condition where stomach acid keeps coming back up into the esophagus. So imagine, like, a leaky faucet,
Okay.
constantly dripping acid onto a delicate surface. Not a pretty picture.
Ouch. No, that does not sound fun. So it's more than just that occasional burning after you eat too much.
Right, with GERD, that burning is a regular thing. And it often comes with other symptoms like regurgitation, a sour taste in your mouth. Some people even have trouble swallowing or chest pain.
Oh, wow. So if you have those symptoms a lot, it's definitely time to see a doctor.
Absolutely. Because if you leave it untreated, it can cause some serious problems like esophagitis, which is inflammation in the esophagus. And over time, that can increase the risk of esophageal cancer.
Oh, wow, that's scary. So what causes this acid to keep coming back up?
Well, it usually comes down to a weakened lower esophageal sphincter.
Oh, right, that valve.
That's supposed to keep the acid in the stomach.
Right.
When it gets weak, the acid sneaks back up.
Like a gate that's not closing all the way?
Exactly. So are there things people can do to prevent this?
Yeah, that's what I was wondering. Like, can you stop it from happening?
Well, some lifestyle changes can make a big difference. Losing weight, quitting smoking, eating smaller, more frequent meals,
Okay.
and avoiding foods that trigger it, like spicy things or greasy foods.
Okay, so making healthier choices can help.
Definitely.
But what if that's not enough? Are there medications?
Oh yeah, there are a lot of different medications. Some of them reduce the amount of acid your stomach makes, and others help strengthen that sinker muscle.
Oh, okay.
So there are antacids, H2 blockers, proton pump inhibitors. There are options, but you should talk to your doctor to figure out what's best for you.
It's good to know there are things that can help. Okay, so what's next on our list of digestive disorders?
Let's talk about peptic ulcers.
Okay.
Those are open sores that develop on the lining of the stomach or duodenum.
Ouch, ulcers. I used to think those were caused by stress.
Yeah, or spicy food.
Yeah.
That's what people thought for a long time. But now we know that most ulcers are actually caused by a bacterial infection.
Wait, a bacteria? Really?
Yeah, it's called Helicobacter pylori, or H. pylori for short. It's a little bug that burrows into the lining of your stomach or duodenum,
Oh, no.
and it makes the tissue vulnerable to stomach acid,
So it's like little invaders setting up camp in your digestive system.
pretty much.
That's crazy.
It was a big discovery, and it changed the way doctors treat ulcers now.
So how do you treat a bacterial infection in your stomach?
Well, if they find H. pylori, they usually give you antibiotics to get rid of it,
Okay.
and they might also prescribe something to reduce stomach acid, like a proton pump inhibitor, to help the ulcer heal.
I bet those ulcers are painful.
Yeah, they can be. People get this burning or gnawing pain in their abdomen, often worse when their stomach's empty. And sometimes they have indigestion, nausea, vomiting. They might even see blood in their stool or vomit.
Yeah, that's enough to make anyone call their doctor. Okay, moving on. What about this diverticulitis?
Oh, yeah,
These notes say that's really common in older people.
it is, yeah. So diverticulitis is all about these little pouches called diverticula that form in the lining of the colon.
So it's like little balloons popping out of the intestinal wall.
Yeah, kinda.
What causes that?
Well, doctors think it's from pressure on weak spots in the colon,
Okay.
often because of a low-fiber diet.
So all those times my mom told me to eat my vegetables, she was right.
She was right. A high-fiber diet can help prevent those pouches from forming.
Okay, good to know. But what happens if those pouches, the diverticula, get infected?
That's when it becomes diverticulitis.
Oh, okay.
And it can cause some problems. Some people just have mild belly pain and cramping. But it can also lead to more serious things like abscesses, perforations, or even blockages.
Wow, so it can be pretty serious.
Yeah, it can. So how do they treat it?
That's what I was wondering.
Well, if it's a mild case, they might just tell you to rest, have a liquid diet for a few days, and take some antibiotics.
Okay.
But if it's more severe, you might need to go to the hospital and get antibiotics through an IV.
Okay.
And in some cases, they might even need to do surgery.
So another good reason to eat those veggies.
Always a good idea.
Okay, wow, we've covered so much today. Everything from how the digestive system works to the things that can go wrong and all the different ways to keep things running smoothly. It's amazing how much is going on inside us all the time.
It really is, and we've only just scratched the surface here.
Yeah, that's true. But I think our listener has plenty to digest for now.
I think so too.
Any final words of wisdom for our digestive explorer?
I think the biggest thing is to just be mindful of your digestive health, pay attention to your body, make healthy choices. And if something feels off, don't wait to see a doctor. because with a lot of these conditions, early detection and treatment can make a huge difference.
Absolutely. Knowledge is power,
Yeah,
especially when it comes to your health.
right.
So thank you for joining us on a deep dive into the amazing world of the gastrointestinal system.
It's been a pleasure.
Until next time, stay curious and keep those digestive boosters flowing 2030.